Welcome to Dare, the show for innovators, entrepreneurs, and startup leaders who dare to shape the future. Your hosts today are Ned Hayes and Cecilia Mariani. Dare is brought to you by Darwaf, the superpower tech team that can make your vision a reality. The Dare podcast is happy to welcome Lloyd Fobi to the show today. Lloyd is the strategic and analytical team leader at Multicare Health Systems. He has over 15 years of experience developing transformative business applications, including healthcare models to increase patient satisfaction and leading teams to solve really hard healthcare technology problems. So I recently heard Lloyd speak on a fascinating panel about the future of AI in healthcare. And we're looking forward to hearing more about his perspective on how technology can keep improving healthcare outcomes. So welcome, Lloyd.
Thank you so much, Ned, for having me. It's a pleasure to spend time with you today and your colleagues. I think it's important to always note that our time together is precious, especially in the remote world. So anytime we have a chance to connect, it's important to be grateful for these moments.
Welcome to the show, Lloyd. Could you tell us about Multicare? How big is Multicare and what's your role there?
Thank you, Cecilia, for that question. Multicare is an 11 hospital system, 250 clinics, over 2,000 providers in our system. We span the Pacific Northwest, and we go from the Tacoma region all the way into Spokane. We even have some relationships in Idaho, in Coeur d'Alene in particular, with some of our Care Connect partners that we offer our services to through either Epic as a partner or other technology systems. And when you think about Multicare, one of the things that we really strive to stand for is actually partnering in our community. And it sits near and dear to our hearts because we believe that is one of the fundamentals to be able to provide a healthy future for our community through this partnering concept that we truly live by.
Well, could you tell us more about that partnering concept and that strategy that you've kind of put into place as an enterprise VP at Multicare?
Absolutely. So when you think about a health system, started off usually with providers and nurses and clinics and hospitals. And you truly become a staple of your community. That's where people come to get their care. And care, honestly, is the fundamentals around how a relationship is built. And I think all of us here who have a primary care provider would realize the importance of that individual in our lives. Because when we don't feel well, one of our loved ones doesn't feel well, we entrust that person. When we look at ourselves at Multicare, we truly believe that we have a responsibility to the community to be in the top quartile in our quality measures, in the top quartile in our performance, but also be low in our expense, in the bottom quartile in the expense of healthcare. And this is the dichotomy that really stretches out healthcare. When we think about partnering, the need to be able to provide this dichotomy is actually through partnering. We cannot do everything ourselves. We cannot be the place where people come and get care and then manage all of their data and then at the same time provide all of their social determinants of care. You quickly realize that you cannot be everything to everybody, but it doesn't mean that you shouldn't provide it. And that's where the partnering pieces come in. Usually in healthcare, there's a strong dynamic, usually of opposing forces between insurance companies and healthcare. And we actually look to break that mold. In our mindset is, well, guess what? Our insurance partners should be able to sit alongside with us because at the end of the day, it's about the person in the middle, and the person in the middle is the patient. How do we do that? We do that actually through negotiating more interesting relationships with them. We have one with our friends from Cambia Health today where we've built out a prior authorization platform that is truly built around data and quick response. It was the first in the nation to be able to come live. You can see it in Becker's last year. And the teams and engineers on this side, alongside our friends from Cambia, did a really good job to be able to actually break ground here around a Da Vinci Code methodology that allows for a partnering relationship between the health system and an insurance company to allow for prior authorizations to happen quicker. That's not only yet. We also see ourselves in the community. partnering with people like United Way to raise awareness for our employees, watching on both sides on how our employees consume healthcare, realizing our employees are also the community in which we live in, whether it's in Spokane, in the Puget Sound area, in Coeur d'Alene, where we have hospitals, or for myself remotely, that lives in the Portland area, is still the essence of when we think about multi-care. It's about how do we place our footprint into the community.
Right.
And speaking of data, quick response, I'm curious, how do you perceive the impact of AI and machine learning on patient healthcare?
See, that's a very interesting component. And maybe I think it's important for us to just take a step back and think about consumerization of information, right? I think all of us now can quickly say we have shopped on Amazon, right? All of us now have placed the food order online. All of us have used the Ubers or the Lyfts to have food delivered to us in some shape or form. The basic essence of that relationship is knowing you and anticipating your demand. If you look at the core principles of how those systems work, is you would most likely buy a pair of pants if you buy a shirt. So what do I get to present to you? You would most likely order something to drink if you buy food in there. The pairing of information is quickly starts building this avatar of a person. Now, when you think about healthcare, this is potentially when you hear some of our industry experts talk about healthcare being behind with this understanding of its data. And it's also understanding the real reason of healthcare wasn't built in its essence to always know its consumer to the fullest. Now, due to some of the work from Obamacare and all the other programs that have come up, has actually forced healthcare down this line in there. So when I think about data today in healthcare, the challenge that you face is piecing together an avatar of a person, piecing together an avatar of a patient. If a patient walks into an emergency room, is this the first time they're walking in? Can the provider know that piece? Were they down the road the last time? What did they complain about last time? How easily is it to pull that information up in front of the provider for them to make a quicker diagnosis? That is where the power of AI is going to really shift our industry. That's where the power of AI is in this cognitive learning to be able to represent information back to the provider or to the nurse or even to the patient themselves of a potential pathway that they're supposed to get on. So back again to the example of a person walking into an emergency room, right? We know very well that an emergency room visit, if you look in the history of a person, 60 to 70% of a population that goes into an emergency room has been in there in the last 24 months. So you see a reoccurring case of a people coming back in, whether it's either due to underlying conditions, COPD, diabetes, high blood pressure, or due to the type of job they work, higher risk of injuries if I'm in the construction world, or if I am a driver, long distance, back injuries. You can see these determinants that can tell you that a person is in a higher likelihood to reoccur. But if you watch the way we actually interact with the patient, we treat each of these cases as a single action item. And that is where data and artificial intelligence gets to actually shift the ball game for us. Okay, we should be able to get to a place where I can predict that every 15,000 miles a driver does, they are more likely to come into my ED for back pain. Now, the insurance company, and this is the key part of having the insurance company next to our arms, would want to know that, because it is actually better for them to prevent that driver from coming in by saying, hey, guess what? At the 14,000 mile, you get a week off. It is actually cheaper for them than actually sending them into our ED. Right. So us understanding our space inside of healthcare as a health system is critical, so that we do not see ourselves in an adversary relationship, but one truly that we partner. And I keep on reemphasizing that word of partnering because it actually sits in our mission of partnering for health, for healing and health and a healthy future. That's fundamentally the mission that Multicare carries. Right.
So you're able to provide better patient outcomes by being able to predict how the body will respond to different situations, right?
That's fundamentally the goal. That's fundamentally the goal. Are we there today? I would say you have pockets that you see this experience in, but there's a continuous toil to be able to get better and better and better in this space. I would not say healthcare is there because I said you talk to industry experts, they'll tell you we are 10, 15, 20 years behind based on who you pick, right? Now you have some spaces that you have seen some massive technology advancements inside, but the fundamental goal, the end of the day, is being able to have a patient and be able to at least get a perspective of where they're going to be going in their healthcare.
Right. So I know you spoke on a panel about AI in healthcare recently, and I was there, and you talked about finally tuning the models. Could you explain a little bit more about what you meant about tuning being necessary to make models effective?
Absolutely. The word I'll put right next to tuning is hallucination, right? And all of our friends in this space would tell you, and this is one of our biggest fears in healthcare today. That's why you're not seeing yet at an accelerating pace generative AI at the forefront in healthcare, because all of us on the technology side, we hold a little bit of the gate to say, before this can be released into the environment, we have to be confident that what it says is very close to the truth in there. So when you talk about fine-tuning the model, that's where our minds go. And the simple example is as simple as the last thing you need is technology creating a diagnosis that is not true. Because the last 10 people that showed up with these symptoms had X diagnosis. So the model of fundamental generative AI, and the simple way I can explain generative AI is, it is the most advanced form of plagiarism. Okay. Yes, it's simply predicting the next word or next letter based on trends of information coming in. So when you think about that, and from that basic simplistic format, you start realizing is, if the three of us showed up in an ED and we all showed up with a headache, and Cecilia on the line's headache was due to a migraine, and Ned, yours was due to not drinking water, the model might predict that mine is most likely due to a migraine of not drinking water. Right? So the data it uses, it's what it pulls. So that's what now we create. We start indicating, and I'm using very simplistic terms to indicate what we call hallucination. So in fine-tuning the model, you start realizing the data sets that you have to use have to be very well encompassing. And this is one of the big gaps in healthcare today. And let me explain even more in there. The reason why is, if you go into a health system in the state in which you live, your information lives on that health system's EMR. Assuming that you're Epic, your information lives in the Epic instance of the state in which you live, in the health system of which you live. I'll pick one. Let's call it Multicare, since we're talking Multicare. Multicare of Texas. Okay. Now, when you come into the health system of Washington, the Multicare in Washington, you have some information there. Epic now has done a great job in trying to combine those data points, seeing you as the same person. But let's say you went to a different system that did not have Epic. Now that's a whole different patient set of information that is sitting out there. So for a model to work well, it actually needs the data from the Epic system and the non-Epic system. And there are few companies coming up today that are trying to combine those data sets to be more accurate. But for us to eliminate hallucination and really predict properly the issues happening with NED, we need the encompassing picture of all of NED. And today we're fragmented in our data in healthcare. So dust sits in the gap that you create when you want to start predicting potential outcomes of people. Hopefully that helps.
Yeah, and it seems, as you were mentioning, I am thinking that it seems that you need more information also about the context of the patient, right? About where the patient lives, how the patient is living, in which conditions, or more information about, as you mentioned, if it is drinking water or not, right? And in some cases, we have all that data around us. So that data is available. it seems
Very
that it's
true.
still used in healthcare systems, right? To have more information about the person.
Mm-hmm. You bring up a very good example, as simplistic as it is. I think to some point we are either all Android or Apple lovers, right? We have an Apple Watch that tracks our heart rate, that can tell you your number of glasses of water you drank for the day, but that doesn't transfer it into your health record. Now, there are people working on trying to transfer that in, but those are all social determinants of your care that are paramount to predicting a potential outcome of disease for you or potential outcome of solution for you. Not just the last 10 people that complained with the same thing that you had. Okay. Now there's some great companies out there. There's a company I've spent some time with called SkyPoint Cloud. The CEO, Tyson Matthews, I actually believe was on stage with us, Ned. And I spent a lot of time with him because he's one of those few pioneers in the space that understands this holistic gamut that you have to mesh and braid together of information. It's truly a braiding component because you're taking information from multiple sources to be able to say, I can get out of hallucination in there.
Right.
Great, thank you. So let's jump ahead a little bit. Imagine that all that you are saying will happen, maybe in 5 to 10 years. So what the future of AI in hospital look like?
That's a great question, Celia, because the future is what we choose to make it. I see a day, and I'm an optimistic person. I see a day where by the time you get to the hospital, you know where you're going, and they know that you are coming, and they are ready to welcome you. And for that to happen, the interaction between the provider and the patient has to be brought closer together, because the fundamentals of medicine started with a patient and a provider. And over the last 120 years, we have added noise in between. We've added people like myself, the technologist, the billers in the back, the insurance companies. But when healthcare made an incline from out of using bleeding as a methodology of solving health cases to actually using evidence-based practices in the early 1900s, we started seeing this mass increase of the distance between the patient and the provider. If you ask me in 5 years, what technology allows us to do is actually accelerate the pace at which we're closing that gap again. COVID actually provided us an opportunity. Now, breaks my heart for all the people we lost, but we did not miss a crisis to get our system better. For the first time, you could pick up a phone and hit a couple of buttons, and you could get a provider on the other hand. Prior to that, you had to call for an appointment, they had to call you back, they had to look at the provider's schedule, the provider had to make sure his schedule was right, and then you were booked, then you had to drive in, then you had to sit in a waiting room. I mean, you could see the gap was just increasing. For the first time, we shifted that gap a little bit closer. I believe the next iteration of where generative AI takes us is actually not in the case prediction, but in the availability prediction. Being able to say is, Ned has a broken leg, he has to see an orthopedic surgeon. At that base level, okay, the next available orthopedic surgeon is in San Francisco. Based on us seeing all these schedules and demand shift, okay, can we do this from a video visit? Or at least what we're hearing from his case is it could be done virtual, because he can take pictures and upload into a system in there. Now, off to the races he goes, because his watch is also pushing out his heart rate to tell us his heart rate is normal enough that he's not in a panic mode about his broken leg. Maybe it's just a hairline. So with all of these data piece information moving, we bring it closer, for it's not a 3-week wait for him to be able to go in and get an x-ray. Okay, so these pieces, I think, is where you start seeing again another seismic shift, bringing a patient and provider back closer together. And the closer we bring those two bodies in, actually, we will be able to reduce our cost of healthcare. And that's the fundamental essence of quality of value-based care. that was laid down 15 years ago in our country is reduction of time between provider and patient measured by quality over cost in there.
It sounds like you really care about the quality of patient care. Can you tell us about what you are most proud of during your work in healthcare, helping people?
What I'm most proud of is some of the silent moments. And the silent moments are the awakening moments. It reminds you of why you do this work. Regardless of the things that happen in your life, I consider myself extremely blessed. Extremely blessed. I have a family that loves me. I have siblings that love me, or maybe they do. And a lot of my siblings are medical doctors. So I see the hard work they put in. I see the toil. And I'll use this example simply because it always grounds me back in. My older sister is a neonatologist. So she lives in a world where she operates on babies that are born prematurely between 20 weeks to 43 weeks. And there are times when she loses one of these babies, and watching the emotional toll on her gives me motivation to try to make the system better in there. And I mentioned the silent moments that affect us the most. Everybody can pick the grandiose stuff of virtual cares and systems you build, but one of the most grounding moments for myself was we were going through a go live for a health system I was with, and we were about to launch the go live, and we get a call that there's a helicopter coming in with a family from a house fire. And we have a choice to make at that point. If we take the system down, the provider that we will be placing in a very difficult position to operate on a family of 5 without this electronic system in there. Or we keep the system up and we find a methodology to do all the fixes we have to do with the system up. Okay. That evening, we did groundbreaking things on how to be able to ensure that a provider had the tools they needed, when to take it down, timing it with the surgeries he was making, and at the same time, doing the technology fixes we had to make. Now, I sit and talk as if I was the one who did the work. No, my team did. My team did. But being part of that group of 6 or 7 individuals that said, okay, new situation, let's brainstorm a methodology on how you can take these groups of service down, do your work, bring it back up when he's up for these moments, was touching for me. Now, we've done a lot of great things in healthcare, but that moment always sticks with me because I walked out of that hospital at 6 a.m. in the morning, and that day I told myself I loved my job because we did something that nobody would know for a family that we didn't want to thank you for a provider that was grateful. Now the provider called me 2 days later and offered to buy me a beer, and we sat down, we talked about the whole situation. But that was the day I realized I loved what I did, and I wanted to keep doing that.
Absolutely. Your work and your team's work really made a palpable difference in the life of that family and made the work of that provider easier because they were able to actually provide that patient care in real time, right?
Very true. Very true. And you said it well, in real time. Right now, that provider has worked in the system when it's all down and he had to use paper. But we challenged ourselves to say, no, why? Why are we here if we're just going to do it the same way?
Right.
In here. And I think that is the piece where I'm really excited about the influx into healthcare from our friends like Amazon and the Googles and Walmart, all these groups coming in, because that injects a sense of urgency, and inside a sense of urgency, you actually find different methodologies of thinking. Being comfortable with the uncomfortable is really what I believe where advancements happen.
Absolutely. So as people continue to grow in terms of patient-facing technology and provider-facing technology, companies are merging. So companies are finding efficiencies in technology. Here in Portland, we're seeing OHSU and Legacy Health combining. So do you have any thoughts about how these mergers could affect patient outcomes and patient care?
Absolutely, absolutely. Now, I don't know the details exactly of our friends at OHSU watching on the news like everybody else. I can speak from the perspective of what we at Multicare believe in. And it truly honestly goes back to we believe we want to be Pacific Northwest's highest value system of health. And to be able to do that, you truly have to partner with friends and family, right? It could mean a merge. It could mean a contractual agreement to share information or share patient care. It could mean and form in different fashions. So when you look at OHSU's skill from an outsider, just the way you all are looking at it, I think it's good for our system simply because we want to be strong as a whole. And in the fundamental essence, for healthcare to get better, a patient has to be known as one through the whole system. So the more the systems can come unified, the higher chance to be known as one. Ned who walks into OHSU should be the same Ned that walks into Legacy, should be the same Ned that walks into Multicare.
Right.
And we should be able to understand the things you had experienced. And this is maybe one of the challenges that makes an uphill battle for us in healthcare, right? I always remind our friends in healthcare is we don't own the patient. We really don't. We're just a servant of them, right? Ned is not my patient as a system. Ned chose our services in here. And so do you have the right to choose another? So I should be judged based on my quality of care I provide to you. So as these systems come as a whole, and I'm really just talking from the intrinsic value of the patient, it's critical that we understand the benefits that happens when these systems come. And I'm certain that the different groups of people that would ensure that other legalities are well taken care of. That is not my space to play in.
Right.
Yeah, so I'm also curious because maybe I'm based in Argentina about your perspective in healthcare around the world. For example, the United States has great hospitals, but maybe worse outcomes for many citizens. People don't live longer with better, I could say, instead of doctors, maybe better healthcare system. Why is that?
Here's one of those sad truths that I think we have to face the mirror here in the United States. Now, Cecilia, just like you, I was born in Glasgow, Scotland. My family's from Cameroon, Africa. And the fundamentals, I believe, of healthcare is actually an empathetic relationship, which is an interesting answer to if you fundamentally think about it. And again, COVID gave us a glimpse into this. Gave us a glimpse. Why did we see so much struggle coming out of COVID? Because we had forgotten our interpersonal relationships. And unfortunately or fortunately, advantages of a capitalist society leads to transactional relationships. And healthcare now in America is built in a transactional format. When you travel the rest of the world, and I'll use the rest of the world with very significant differences. I'll pick Spain, for example, in there. If you look at Spain, they still have a siesta in the middle of the day, right? And I promise you that is massive in the length of time. You go to Japan and you look at the food choices, the activities after work, the things companies insist you do is to rebuild the empathetic side of your life, connectivity in there. I believe the difference that we see when we come into the United States is fundamentally based on that the social determinants of health are not focused upon as much as the medication side. In America, we're heavily driven by pharmaceutical companies. We're heavily driven from the insurance side. Different. And I can speak to this. I mentioned to you, I have a lot of family members who are in the medical field. Now, when I have two medical doctors in my family choose to leave the United States to go to India for certain procedures, that should tell you something. And then that's fact. I mean, I sat down, we had great conversations over Thanksgiving on why and how. And it was just not a problem of cost. it was a problem of access, it was a problem of preparation, it was a problem of trust. And they work in the system, right? And those are the things that give us motivation. So as you talk about Argentina, one of the things I reflect on is when I go back to Cameroon, even in a country abject in poverty compared to the United States standards, when I go see a doctor there, and I had to go see a doctor because I had a kid who had a cut on their finger. We still sat down and had a conversation. Asked me about my family. Said, Lloyd, you've not been back for a while. How's life? How are the kids doing? How's your wife? And I think about my difference here. Here we put doctors on a timer, average 7 minutes per patient.
Wow.
And that empathetic piece is missing. And I keep on coming back to the distance between patient and provider. Has to get back closer. And then I think there's studies out there that actually show that the outcome of a patient is higher with more empathy relationship with their provider. How they feel about their outcome gets better. And if you feel positive when you're sick, your chances of getting better actually tend to get higher in there. So.
Yes.
Well, you've also been influential beyond your volunteer work with underprivileged youth. You've also helped various companies, like I think Braided Data Studio and other companies. So how have you come to help smaller companies out there, and how do you contribute there?
Absolutely. And I think when you're in this space of entrepreneurism, you love seeing people come off the ground. Actually, the key word is I love disruption in there, because inside of disruption, you always end up cracking the seed to plant a tree that will stand for years to come. And also inside of disruption, you find the space to innovate, and you find a different way of thinking. And that uncomfortableness develops a strength of rigidity in us. When we think about Braided Data Solutions, for example, I mean, this is 2016 when people were not even talking about AI. People knew about it, but people couldn't place a finger on it. And what this company was doing is they were already using the ability to predict the next letter to help write memos for lawyers and things of that nature. And they're really focused in the legal space, because guess what? That's a lot of paper crunching and development of materials that you need to do in that space. Now, ChatGPT has taken it to a whole nother level, but the fundamental essence was the same. Today, I continuously volunteer my time for a host of startups that are thinking about critically shifting healthcare. And my fundamental principles are simple. It first starts with who the leader is. The CEO of a startup. Do they truly believe, are they in it for the right reasons? Do they have the passion to be able to run the race in there? And the methodology I always think in my mind is, and I go to sports, I apologize. Finals of a World Cup. Yeah, finals of a World Cup. You have the last penalty kick to take. Would this CEO raise their hand and say, give me the ball, I will take it? Do they have the personality of calmness, focus, to be in that spot and want to be in that spot? It's so critical, because the battle to the top is treacherous. It is hard. And along the way, you have to be certain the person will not give up on you. So the first measure, usually when we look at startups, is who is the leader of this group? Do you have the personality to want to have the last shot in a game, 10 seconds to go in there? The second is, what is the space in which you're playing in? Can you make a seismic shift with the actions you're taking? And when I think about a couple, and unfortunately, I wish I could name names, but underneath some NDAs in this regard, but there are a couple that we're assessing today that are doing some amazing things inside of value-based care, which is actually a passion, because that's where the data piece comes in, right? And when we think about value-based methodologies, it is going to be our lives by 2030. There is no way we can keep on affording the healthcare system we want if we don't fundamentally shift how it gets paid for. in there that is driven by actually quality. And Cecilia, you talked about this, the difference around the rest of the world, actual quality in the care. And most of the groups in this space have come to realize this. It is actually about the social determinants.
Mm.
If you can manage a person's social determinants, the ability to eat well, the ability to have a good job, the ability to have basic hygiene, the ability to have dental care, those components shift your expense into the system, right? So we have a handful of these companies today that we look to provide advice to think about where we see hospitals shifting to, right? And this is one of the sadder parts about what, if you ask my opinion, I think, unfortunately, hospitals will not be the place you come to get care, because that care would actually be brought to you in the future. Hospitals will be the place you would just come to die. But it should be a good experience still. It should be a peaceful one. Okay? You should still have your loved ones next to you. And that journey should be as peaceful and joyful as childbirth in there.
That's really a profound vision for a healthcare continuum that goes beyond just kind of that 7 minutes with a doctor. It's creating an entire experience that is healthful, right?
Mm-hmm. Yeah, very true. Very true. It's truly and it's not a bad thing. It's really not, because it's an event that we all will experience.
Mm-hmm.
Okay, it's an event we'll all experience. And if you've had a loved one and been through this journey, you appreciate the empathetic ability of the nurses around you, the empathetic ability of the provider, the empathetic ability of the system. Imagine walking in to a hospital on the day you have to turn off a ventilator tube for a loved one. And from the front desk when you walk in to when you're in the room, they know you by name. Everybody along the way stops and expresses their gratitude for the support, offers you support, ensures that when you walk in, the room is set up in the colors that your loved one likes. They've thought about the details. Because guess what? When you walk into a hotel, a high-end hotel, that's what happens.
Mm-hmm.
And the hotel is not magical. They just have the data. They just know your first name, your last name, your 3 kids, your mom, your dad. They have done some research of pulling your LinkedIn profile and your social media profile to see the things you like. Do you understand you love cigars, or maybe you love NASCAR? They have a little toy NASCAR in the room for you, or a box of cigars. Or they know you love shopping at Louis Vuitton, so they have a gift card for you down. And these are not extraordinary things, but they're touching.
Mm-hmm.
They build loyalty. And when I think about where hospitals go next, it becomes a hospitality business.
Right.
Wow, you are very inspiring, all the things that you are mentioning. So I have a final important question. Our podcast is about people who dare to dream. So what do you dare to dream, Lloyd? What future do you dare to imagine you are creating?
I am sometimes simplistic in my dreams, and I center them around the things I love. I think about my children. I have 3 rambunctious kids, and my middle daughter is 13. And I asked myself this question a couple of nights ago. What would life be when she has her first kid? Okay, that could be 10, 15 years from today. So I accelerate down into that window and call it 10 years or 15 years from today. What experience do I want to ensure that she has? So the ability to dream in such a precise, concise manner helps me really focus task. Okay. Now, that would make me a grandfather. So it will be a joyful moment. It would be a joyful moment. But what I do want for her is the ability to understand what the process will be. That generation is growing up on their phones and social media platforms. So we have to shift the consumerization of our health system to be a consumer product. Today, it's a commodity. That is, it's an asset that sits on the side of the road somewhere. You go into that asset and you come out of that asset. By the time she's consuming healthcare at a high rate because she's a new mother, she would want 90% of it to be at her own pace, wherever she wants, however she wants, because that's how she consumes her social media. When she wants to talk to her doctor, she wants to flip on the app and ask a question, maybe not get on video, and she needs a response. Hopefully our generative AI is smart enough to interact with her at that point. Maybe she has her own bot that's personalized to her. And that bot is built to know her, and all of her data points are built around her bot. When she now has to go into the hospital, or maybe she doesn't, her interaction is specialized to her.
Mm-hmm. So it's really finely tuned to that experience. That's an amazing future. Hopefully we can work together with you to create that future. Yeah.
Absolutely.
Well, thank you for your time, Lloyd. Really appreciate it.
Well, thank you both, Cecilia and Ned. I really love this conversation. These are the moments that gives me energy to do what we do. And same here, I am very open to keep on conversations going, finding spaces. There are always problems out there where we need thought partners that see it differently than us and push us to think differently. One of our key areas today is data and data visualization, and making it accessible on platforms where our providers live already. So I'm very open to scheduling time and diving deeper into that.
Thank you very much, Lloyd, for all the explanation and everything what you mentioned. I think that you made my day, just with someone to really care about the healthcare system. So I go to a lot of healthcare conferences. I have my mom that is a doctor, my sister is a doctor, but you were talking about in a different point of view that I really love. So thank you very much for this.
Thank you so much.
Podcast.
Thanks to our guests today for their great insights on DARE, the podcast for innovators, entrepreneurs, and startup leaders. If you'd like your story to be featured on DARE, just contact us at info@darwaft.com. DARE is brought to you by Darwaft, the tech team that can make your vision a reality.